Okay, so the MIRADRY is a lasting solution to excessive or bothersome underarm sweating. And after 2 treatments, most people find that their bothersome underarm sweating is basically eliminated. So Debbie, our certified plastic surgery nurse, is performing the MIRADRY procedure on our patient Jackie. Jackie, how are you? How does it feel?
It feels fine, no pain at all.
And so Debbie, it looks like you're operating on a grid. What does that grid show you?
This grid has been measured pre-procedure, so we know where the hair follicles begin, and we're within that range. And on Jackie in particular, both armpits each have their own size grid. They're not the same exact size. So that's very important to have the right measurements. And you do this all pre.
So Jackie has been numbed.
She has.
And Jackie, you're not feeling any pain?
Not any pain at all. It feels slightly warm, which is not at all uncomfortable.
So it does have a warming period, and then it has a cooling period. And she's about to reach her cooling period right now, and she is in her cooling stage.
So there's a warming period and a cooling period for each application of that handpiece?
Yes, and it cools throughout the procedure, but this is just after it finishes. This is the long cooling period right now.
Now, Jackie, you just had your other underarm treated, correct?
Correct.
And how is that arm feeling right now?
I have an ice pack there, so again, no pain. It just feels cold.
And we just follow the grid. It's all marked. We follow it along the way. And she'll return in 3 months to have her second cycle done.
So it's 2 treatments, 3 months apart.
That's the recommended treatment is 3 months. You can do them prior, but waiting 3 months is probably the best way to go. And you can have 3 treatments, but usually 2 treatments takes care of it. So that's just a very rare thing that you would need anything more than 2.
Now, Debbie, you are a registered nurse.
I am a registered nurse, certified in plastic surgery. And I have been trained on this particular machine through one of the representatives of the manufacturer.
And one of our doctors just got this
treatment last week. One of our doctors got one last week, and he's loving it. And a couple of staff members also had it.
So each underarm was prepared with a brief series of lidocaine injections.
Yes. Yes, everything has been calculated out on a worksheet according to the patient's weight, so that we avoid any kind of toxicity. And we know the maximum amount we can inject, and we need to stay within that range.
How long does it take to do each underarm?
About 5 minutes.
So it takes about 5 minutes to do each underarm.
The actual procedure.
The actual procedure takes about 5 minutes per underarm.
Per underarm.
Now, the entire visit, how long does that take? Because you have to prepare and...
We usually give them about an hour for their consents and to prepare and prep the arm and do the calculations and get the rest of the information from the patient. And we want to make sure they're comfortable.
Jackie, you look very relaxed.
Oh yeah, I'm fine. Good.
Are you feeling anything?
No.
Good.
No pain.
She may have a little bit bruising. Most of it would be from the injection sites. That's very normal. And her swelling, and she has her ice pack. She knows no exercise for 5 days. And that's to prevent some unnecessary swelling.
So this procedure works by heating the eccrine glands, also known as the sweat glands,
Correct.
and it's FDA approved,
Yes, it is.
and it's lasting. After 2 treatments,
It's permanent.
It's permanent. You won't need
Permanent
to have it done
changes.
again.
After the 2 treatments.
Now, do most people find that they don't need to wear deodorant or antiperspirant after these treatments?
Most people do.
One of our doctors said that in addition to destroying the eccrine gland, the sweat gland that actually causes the bothersome wetness that patients experience, it also the MIRADRY also destroys the apocrine gland, which is the odor gland. So the MIRADRY, while it is mainly for excessive underarm sweating, may have a beneficial effect on odor, underarm odor as well.
That is a plus. That is one of the plus factors to having this done.
Didn't know.
So I'm going to show you, this is the red that you can get. They kind of look like little hickeys. And that's from the suction.
And that lasts about 1 to 2 weeks.
About 1 to 2 weeks, and that's it right there.
And Jackie, you say you've just had your MIRADRY treatment at the Austin Weston Center for Cosmetic Surgery. And how do one of your underarms has an ice pack.
Yes.
And Debbie's about to give you an ice pack for your other.
Yes.
And how was the treatment?
It was great. No problems at all. The localization, there were a few injections that felt a little pinchy, but once they started getting underway, the armpit started numbing, so it really wasn't bad at all.
Thanks. All right, well, Jackie, thank you very much for letting us tape your MIRADRY treatment.
You're welcome.
Thanks. Thank you, Debbie.
You're welcome.